Today is a great day to end the AIDS epidemic. Thank you, Alfonso. We're grateful for your tireless efforts to help us achieve this day. I also want to thank Deputy Secretary for Health, Courtney Burke, who some of you know has been an End AIDS 2020 champion from the community's very first meeting with her in August of 2013. Commissioner Howard Zucker for his unswerving support, Task Force Co-Chair Gus Burkhead, AIDS Institute Director Dan O'Connell, and all of the staff of the AIDS Institute, as well as my 62 colleagues who served on the Ending the Epidemic Task Force and who worked with tremendous intelligence and energy to produce the document we present today. Governor Cuomo, I was never so proud to be a New Yorker as that day last June when you publicly committed New York State to ending the AIDS epidemic by 2020. I want you to know that your task force members have put in many hours of hard work. We held 17 listening sessions all over the state and gathered hundreds of recommendations from the public. Then, relying on the support of experts throughout your administration and beyond, the task force distilled this wisdom into 30 recommendations that, if fully implemented, will achieve the goal of less than 750 new infections in 2020 and begin to actually reduce the number of people living with HIV for the first time in now more than 30 years. Then we added 7 additional recommendations that we believe will get us very close to 0 new HIV infections, 0 AIDS mortality, and an end to stigma and discrimination directed at people living with HIV. It is a real tribute to the New York State AIDS Institute and to the commitment of my colleagues that while we fully debated every idea put forward, we achieved every single decision by consensus and completed our work in just 92 days. The bulk of our recommendations tracked the 3 pillars of the vision you announced last June. You set a goal of getting each undiagnosed person tested and into care, and our recommendations spell out how to do that. You articulated a second goal to link and retain persons with HIV in care to maximize viral suppression and keep people healthy and prevent further transmission. Our recommendations spell out how to do that. The third goal you announced is to provide access to antiretroviral prophylaxis for people who are at highest risk of infection to keep them HIV negative. And we offered recommendations to expanding understanding and access to PrEP and NPEP throughout New York State. Other key recommendations to decrease new infections and halt disease progression include ensuring access to stable housing, assuring transgender health care and human rights, increasing access for people with HIV to vocational opportunities and employment, promoting comprehensive sexual education, removing barriers and disincentives to possession of condoms, and fully leveraging your innovative Medicaid reform to advance the end of AIDS goals and secure necessary resources. Finally, to get to 0, we have recommended establishing a single point of access in every locality for housing, transportation, and nutrition assistance. A complete ban on the use of the possession of condoms as evidence of crime. Reforms including complete syringe decriminalization for user health. Passage of the Gender Expression Non-Discrimination Act. Passage of the Healthy Teens Act. Expanded Medicaid coverage for transgender health services. And guaranteeing minors the right to consent to HIV treatment and prophylaxis. Governor, we are tremendously gratified by the actions you've taken even before the release of the blueprint. You've already expanded access to transgender health services. You've eliminated written consent for HIV testing in correctional facilities. You've limited the admission of condoms in criminal proceedings for misdemeanor offenses. You've addressed the legality of syringes exchanged through syringe exchange programs and continue the 30% rent cap. And Governor, we sincerely thank you for your allocation of $10 million in new money for the AIDS Institute to launch new initiatives. Governor Cuomo, back in 1982, when AIDS was seen solely as a, quote, gay disease, your father, then a newly elected governor, had the courage to sign into law a bill that created the New York State AIDS Institute and the AIDS Advisory Council, making New York the first state in the nation to develop a formal, centralized program in response to the epidemic. In fact, by the end of Mario Cuomo's third term, New York State had created the largest and most robust HIV/AIDS prevention and care infrastructure in the world, creating the foundation that has made today possible. Yes. Already, we have made such remarkable progress, virtually eliminating perinatal transmission, reducing transmission related to injection drug use to less than 100 cases in 2013. But we rely on your leadership to finish our task. We have a surging heroin epidemic and must continue to expand harm reduction-based health services for people who use drugs. The rate of new HIV infections remains unabated among young men of color who have sex with other men and among transgender New Yorkers. We must use every tool available to stop transmission among our Black and Latino, gay, bisexual, and transgender youth, including providing an environment that says we care for them and will afford them both opportunity and a future free from discrimination. Governor, you have already exhibited your father's courage by committing New York to be the first jurisdiction in the United States and indeed around the globe to end AIDS as an epidemic. And you've made a substantial down payment on that commitment. From supporting gay marriage to improving access to food stamps, you have proven yourself a champion for people who have been excluded. Now, in delivering this blueprint, we count on your courage, drive, and tenacity to achieve our common goal. We know there is hard work ahead, and we stand ready to do our part. Today, in front of the LGBT Center, we stand on sacred ground. It was here that a group of terrified people, confronting an unknown disease, decided to fight back and dared to act up, even as so many of us continued to die. We stand on the shoulders of these brave men and women, much as your goal to end AIDS is built on the groundwork laid by your father. So on behalf of my co-chair, Gus Burkhead, and all of the members of the task force, in tribute to your father, Mario Cuomo, and in honor of our many lovers, brothers, sisters, and friends now dead, we present you with this blueprint to end the AIDS epidemic in New York.
Good afternoon. What a beautiful day in every way, isn't it? First, to Charles King. Charles King is a visionary when it comes to dealing with this crisis. I remember when I first met Charles many, many years ago when this crusade just started. He wasn't wearing glasses then. He didn't have as much gray hair then. Neither did I. But this has been a long, long road. And it was a hard road, and it was a sad road. And it took a person of real courage, determination, and intelligence to lead the movement, and that was Charles King. And let's give him a round of applause. Stand up for Charles King. To Glendon, the whole team at the LGBT Center, it's a pleasure to be back. Once again, we admire your work and what you do. To Alfonso David, who's my new counsel, right outside of the box. He did pretty good, didn't he? Our Health Commissioner, Howard Zucker, and our Deputy Secretary, Courtney Burke, who, when this first started, people thought it was an outrageous goal. And they showed that sometimes what sounds outrageous is exactly what we need to do. Howard Zucker, Courtney Burke, let's give them a round of applause. And two great representatives, Senator Brad Hoylman, Councilman Corey Johnson, thank you very much for your leadership. Well, my friends, today the sun is shining, and it's appropriate, because today we see a real ray of light in what has been a 35-year nightmare. It was the early 90s when the nightmare started. It was cruel, it was frightening, it was relentless. And New York was ground zero of what would become known as the AIDS epidemic. And in those early years, it wasn't just a medical crisis. It was a social divide, and it fanned the flames of bigotry and negative stereotyping. It led to blame and anger, to tremendous loss and tremendous grief. Over those 35 years, 153,000 New Yorkers' lives were lost. 153,000. Many of our finest, many of our most accomplished, many of our most creative, youngest New Yorkers were lost. And while the AIDS epidemic brought out the worst in some, in New York, it also brought out the best in some. It brought out courage, and it brought out leadership. The LGBT Center is a monument to that courage and that leadership. Started in 1983 as one of the first centers in the country to provide social, cultural, wellness, and health-based programs to lesbian, gay, bisexual, and transgender New Yorkers. As you heard from Charles, 1983, my father, then Governor Mario Cuomo, is not with us today. We lost him in January. But he did create the first state AIDS Advisory Council, the first state to stand up and have the honesty and the courage to admit the extent of the crisis and to demand government responsibility for the crisis. And he was the first to say a state should open its arms and welcome in all its citizens and work with them to get through this crisis. And that changed the tone of the debate in this nation. And I am proud of that today. 1986, I was working with a group called HELP that partnered with a fantastic organization, Project Samaritan, to build the first residential treatment center for people who are HIV positive in the Bronx. In 2000, Al Gore came to this center a day before the Super Tuesday primary to speak on behalf of equal rights for LGBT New Yorkers. And today, New York leads the way once again by raising the bar and saying we will not stop until the AIDS epidemic is part of the past, like tuberculosis and measles and polio and influenza. We will not stop. We will not stop until we add AIDS to the list of conquered killers, which are a distant memory and are not present today. Now this blueprint that was provided by the task force, it is smart and right. More testing, more health care, more access to new drugs like PrEP can lead us to end this epidemic. And once again, New York State is going to do what New York State does best. It is going to lead this nation towards a progressive future. New York says today, we are the capital of individual rights. We are the capital of community responsibility and government innovation. New York is audacious, as Glenda has said. And we will not be told we can't do it. We can do it. We can end the AIDS epidemic. And we can do it by 2020 and make it a reality. And New York says that compassion is still the foundation of strong community. And New York says the strongest four-letter word is still love for all our citizens, all our brothers and sisters, of all sexual orientation, of all races, of all color, of all creeds, and bigotry and discrimination has no place in the state of New York. We are going to do this in New York, but this is going to resonate all across the nation. And this goal is going to be indisputable, and you will feel it move like a wave from the East Coast all across the West Coast until every state stands up and every state says they are committed to ending the AIDS epidemic. We did it once before, when this state had the courage to stand up and pass marriage equality and end discrimination for gays or people of sexual orientation. New York passed marriage equality, and it changed the dialogue all across the country. After New York passed that law, every politician in the country was asked the question, will you do what New York did, and will you pass marriage equality? And the same thing's going to happen here. And they're going to put that microphone in the face of congressmen and senators and presidents and governors and say, will you end the AIDS epidemic in your state the way New York is ending the AIDS epidemic? That is who we are as New Yorkers. And that is what we are going to do and commit ourselves to do today. There's a lot of work to do in this blueprint. We're not there yet, but we're going to honor the 153,000 brothers and sisters that we lost. And we are going to dedicate ourselves to this goal. And we are going to lock arms and work night and day, and we are going to get it done because we must end the epidemic. We must do it by 2020, and then we must say to this United States of America, every state and every community has the same obligation that we have here in New York. Let's show them what's possible. That's the New York way. Thank you, and God bless.